Hi, it's March Madness, the nursing professor, and I'm talking to you today about high-risk pregnancy. So this will be the 5-minute wrap-up, and I'm going to try to get through this in less than 5 minutes. So high-risk pregnancy, what is that? That's any pregnancy that carries an increased health risk for the mother or the fetus. Above more than 50,000 people, I should say, in the U.S. experience severe complications each year from pregnancy. And I know most of us think like, oh, you just get pregnant, you have a baby. No, there's a lot of things that have to happen at several intervals first of all, to get pregnant and during the pregnancy development for you to have a healthy baby with no complications. Black women, unfortunately, are disproportionately affected by high-risk pregnancies, and we are 3 times more likely to die from complications of high-risk pregnancies than white women. What are the pre-existing conditions that can put you at risk? It would be diabetes, and that means already having these diagnoses and getting pregnant. So having diabetes, having fibroids, especially depending on where they are located in the uterus, hypertension, HIV/AIDS can cause a problem. Kidney disease, depression, autoimmune diseases, especially lupus is a big one. PCOS, which is polycystic ovarian syndrome, obesity or low body weight. I was going to say birth weight. Thyroid disease and blood clotting disorders. Preeclampsia affects easily 2 to 8% of pregnancies and can end in death. What is preeclampsia? Preeclampsia is diagnosed when it's new onset hypertension. So this is the patient who got pregnant, never had high blood pressure, is not on any medications or anything, and is found to have a blood pressure over 140/90 at 2 separate visits. So it could be the same visit. Let's say you were there for a glucose tolerance test and they did it and they took your blood pressure when you came and it was over 140/90, and then 4 hours later they took another one. You're going to now be diagnosed with preeclampsia. Also, if you came in and you just had one blood pressure over 160/110, then you are preeclamptic. At that point, what does that patient look like? They usually have edema. They usually complain of headache, blurred vision, sometimes brain fog. If they start to complain of unilateral symptoms or the worst headache of their life, these are patients that we still would do a CT scan on. Of course, they would shield the baby so to make sure there's no harm given to the baby. But we're now concerned that you might be developing a stroke, and so we would want to act on that. So you might even see orders for like a CT scan if they had severe neurological or complaints. So I say like severe headache, I meant to say. Also, when you check their urine, they're spilling protein in their urine. They also have, I said the edema. So one of the things you're going to do with them, as all patients, you're going to take vital signs. You're also going to check their weight. You are going to dip their urine because you're looking for the spilling of the protein. And you also are going to do fetus monitoring because you want to make sure that the baby is okay with what's going on, because now you're concerned if the placenta is delivering all of the nutrients and the circulation that it needs to give the baby for the baby to be in a good environment staying in. You should expect that the doctor might order a chemistry panel, and some of the interventions would be magnesium that they would want to give to prevent the chance of the mother seizing. Once you start seizing, that's eclampsia. And we are trying to avoid that at all costs. You might see an order for IV fluids. These patients are put on a low sodium diet. They are usually placed in a left lateral position because you get better circulation that way. And you also are probably going to prepare for possible labor induction. They also might give corticosteroids. Actually, if they think that they're going to have to deliver this mother, you will see an order for corticosteroids because they want to speed up the maturation of the baby's lungs so that if they have to deliver the baby early, the chances are the baby will do better if their lungs are more developed. So there are some quick pointers on high-risk pregnancies, specifically preeclampsia. All right.